we must acknowledge that the genetic COVID-19 genetic injections cause far more harm than good and provide zero benefit relative to risk for the young and healthy. They do not reduce COVID-19 infection, which is treatable and not terminal. Furthermore, the most recent data demonstrates that you are more likely to become infected or have disease or even death if you've been vaccinated compared to the unvaccinated people. This is shocking to hear, but it is what the data are showing us. The data now show that these experimental gene therapy treatments can damage your children as well as yourself. They can damage your heart, your brain, your reproductive tissue, and your lungs. This can include permanent damage and disablement of your immune system.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
I really do believe that the federal government is captured, and it's captured by corporate interests. The entire U.S. population, as well as the world, has to understand they can no longer take these COVID vaccines. They are toxic and lethal and ineffective, that they have completely failed. They can only be viewed as harmful and they need to be stopped.
And does it damage the brain? You bet it does. Does it damage the heart? Yes. The liver? Yes. The bone marrow? Yes. It causes all sorts of harm in the human body. We should have stopped this before it ever started.
It's a misinformation from the CDC, the FDA, the American Board of Obstetrics and Gynecology, the American College of OBGYN, the Society of Maternal Fetal Medicine. It's a misinformation from those organizations that is causing a lot of death and injury in my women of reproductive age, my pregnant women, and my preborn babies. And it's got to stop, and it's got to stop now.
And for the vaccines broadly, we have no idea what's going to happen long term now that they're in the body. Studies suggest that the vaccines and the spike protein that's produced from them never leaves the human body.
The first and most important thing, don't take any more vaccines. Don't take any more boosters. Do not take any more of these dangerous experimental therapies.
Dear colleagues and supporters, we declare that Pfizer, Moderna, BioNTech, Janssen and AstraZeneca and their enablers willfully withheld and omitted crucial safety and effectiveness information from patients and physicians and should be immediately indicted for fraud. We know that shortly after administration of these products, thousands of people have died. And although correlation isn't causation, reasonable criterion have been applied to examine the relationship between injections and the events, and it's absolutely clear-cut that these are the cause of death. Mechanistically, the design of these products was knowingly deficient in a number of ways. First, they cause the expression in the human body of toxic virus spike protein. Unlike what they told us that it would stay in the injection site, they distribute widely around the body. There is no built-in limit to the amount of toxic spike protein that can be made or for how long it is made, and that's the cause of the toxicity. Turning to the clinical trials, there is evidence of questionable practices all around. For example, several of the studies were clearly unblinded while they were ongoing, contrary to best practice. And also, in a number of cases, subjects were removed from the database prior to statistical analysis in a way that is suggestive of fraud. We were given blanket assurances time and again by all of the companies about the benign safety profile of their products. Even as the products rolled out in the earliest weeks, they must have known this was not true. To add insult to injury, it appears that these products provide little or no protection from the virus that they sought to protect us from.
Two questions get asked when people have hesitancy or reluctance to get vaccinated. Did you go too quickly is the first. The answer to that is the speed was a reflection of extraordinary scientific advances and did not compromise safety, nor did it compromise scientific integrity. The next question is, okay, but what about the fact, is it really safe and is it really effective? Or is this something the government is trying to put over on us? Is this something the companies want to take advantage of? Well, let's take a look at what's happened over the past few months.
I'm going to be very clear about this, and I've recently just testified in the U.S. Senate, December 7th, 2022. The vaccine is killing people, and is killing large numbers of people. It fulfills all the criteria for the Bradford Hill tenets of causality for a medicinal product causing death. Our CDC, as of December 23rd, 2022, has over 16,000 Americans that have died within a few days of taking the vaccine. And that's probably a gross underreport.
We don't know if these vaccines will work. We don't know if they'll work to avoid deaths. We don't know if they'll work to avoid transmission. That's why we're working on so many first-generation vaccines.
How do we know if these vaccines are working?
You'd like it to be very safe in all the populations that you indicated for, no side effects. And then you'd like it to avoid the individual who gets the vaccine getting sick.
So where are the criminal charges going to first come? I think the easy ones to go after are illegal advertising. The vaccines have been advertised by the CDC, NIH, FDA, DHS, and the vaccine companies as safe and effective. Americans know they can't do that. The vaccines have to be presented with risks and benefits, including fatal myocarditis, blood clots, and neurologic damage. We haven't seen that on TV. That violates the Lanham Act, the Truth in Advertising Act, the U.S. Drug and Cosmetic Act. That is an easy conviction for wrongful advertising of all those entities. That means government entities being called for malfeasance or wrongdoing. And then beyond that, the big charges are fraud. America has been defrauded in so many aspects of pandemic response. Lives have been lost, and I think the big ticket item will be mass negligent homicide, tying together wrongful advertising, defrauding the country, and then leading to deaths due to lack of early treatment and then vaccine-induced deaths.